Dr. David Schiller here, and today we're going to be talking about the relationship between inflammation and depression, and particularly in respect to people who have autoimmune hypothyroid or Hashimoto's. I can't tell you how many women come in to see us for their low thyroid who have yet to be diagnosed with Hashimoto's. They've never even heard of it some of the time, yet Hashimoto's is the most common cause of low thyroid in this country. And Hashimoto's, which is an autoimmune attack against your thyroid, boils down to the fact that it is the immune system that is the problem. Yes, you're having hypothyroid symptoms, but until you take action against the inflammation or what is triggering that immune system to cause the problem, you're yet to get the condition in check. Many women come in and they're being treated for their low thyroid. They're on Synthroid or Cytomel or Armour thyroid, and yet they're still having symptoms. They're being checked for their markers, and their TSH looks fine, their T4 looks fine, but yet they feel horrible. So the reason is many of them have not been checked for Hashis, and the way you can check for that autoimmune process is by checking the antibodies. Now, many a time those antibodies come back negative on blood work. Now, that doesn't mean that you don't have autoimmunity. Sometimes people's immune systems are so weak they can't even produce antibodies. So you need to check them over and over again. Now, another hint that you may have autoimmunity is the fact that your symptoms come and go. They get worse, they get better. You have symptoms of not only low thyroid, but high thyroid. Another sign of that is that when they check your blood work and they're looking at your markers from month to month or every few months, they're finding that they can't regulate it with the hormones that you're having, most likely due to the fact that that inflammation is causing the markers to shift, even though you're on a regulated hormone dose. So what happens is that you have this inflammatory process going on in the body, and the inflammation itself, the cytokines that are produced from that inflammation, they can start to break down the blood-brain barrier, which can produce inflammation in the brain. It activates the immune system in the brain. There's a whole separate immune system in the brain that can start to target neurological tissue and start causing the brain fog that you experience. The brain fog that you experience, particularly if it comes to memory, is due to the fact that that immune system is going after parts of the temporal lobe and the hippocampus, which are deep portions inside the brain here that help you build memory. So you'll walk into a room and not know why you're there. So there's the brain fog. Now there's a larger and larger amount of evidence that shows that this inflammation in the brain is then related to depression or your feelings of depression. And when women come in and they're going back to their doctors over and over again and they're not getting satisfaction, they're telling their doctors that they're being treated, but yet they still feel horrible, and the doctors start giving up and they start saying, well, it's in your head, you must be depressed. And this is very, very discouraging to the patients that I see. They know they're not depressed, they know it's not all in their head, they know that something can be done, and what is happening is the underlying inflammatory process that's occurring because of the autoimmune thyroid, which then breaks down the blood-brain barrier, causing inflammation in the brain, is what starts relating into and start to contribute to the depression symptoms that they're feeling. So many of those women who are then told that they're depressed are being put on antidepressants, and then what happens, because they truly don't have a deficiency of these neurotransmitters, it literally is the depression being caused by the inflammation, they jump from antidepressant to antidepressant. And this may be you. You've been on Prozac or you've been on other forms of antidepressant, and every few months or after a few months you now find that medication is not working anymore, so they put you on another one, or they put you on cocktails of different medications to see if they can bring you out of this depressive state. But really what it comes down to is that there's an inflammatory process going on in the brain due to the autoimmunity that has not yet been diagnosed, and once you get this thing handled, you'll find that you'll be able to start lifting the body out of that. The brain fog starts to disappear. So on some ongoing posts, we'll talk about where does this inflammation come from, particularly when you have these autoimmune processes, how you can take care of it, and we'll go from there and give you some more information that you'll be able to use so that you can get back on the road again. So thanks again for watching, and make it a great day.